Hi, thank you all for joining us today. We are thrilled to co-host this webinar with the National Immigration Law Center, also known as NILC. In May of this year, the U.S. Department of Health and Human Services, through CMS, finalized a rule that will expand health coverage to DACA recipients. Starting this November 1st, Dreamers will be able to enroll in health insurance coverage through the ACA Health Insurance Marketplace via healthcare.gov or their state-based marketplace. For Dreamers that enroll in Marketplace plans before November 15th, they will be eligible to have their coverage begin on December 1st, 2024. There are an estimated 100,000 previously uninsured Dreamers, and approximately 10% of all Dreamers are Asian American or Pacific Islander. At APIAHF, we firmly believe that healthcare is a right for all. We are thankful for the efforts of the Biden administration to expand healthcare access for immigrant communities, and we want to thank you, our partners, for being trusted messengers for tuning in today and working tirelessly every day to make sure that our communities are informed and able to access quality, affordable healthcare. It is now my pleasure to introduce Morgan Greenwald, a health insurance specialist who works on marketplace eligibility, policy, and operations for the federally facilitated marketplace. She has worked at CMS for the past 5 years, and one of her focus areas is marketplace eligibility for non-citizen consumers. She worked closely on CMS's finalization and implementation of new regulations effective November 1st, 2024, under which DACA recipients will newly be considered lawfully present for purposes of enrolling in marketplace coverage. Thank you for joining us, Morgan.
Yeah, thank you so much for having me. I'm really excited to be here with you all today. I am going to share my screen and have some slides, just walking through kind of a high-level overview of what was in the final rule and some key points to keep in mind as we move into open enrollment. So we're going to cover the provisions in the final rule that apply to DACA recipients and also briefly touch on some changes that can impact other non-citizens as well. We'll talk about a special enrollment period that is available to DACA recipients, and we'll talk through what consumers can expect the application process to look like for them, including both the application itself and any steps that consumers might need to take to verify their immigration status with the marketplace. We'll share some best practices that we've been sharing with our assisters and navigators and agents and brokers over the past couple of months, and that we want to make sure are, heard loud and clear by those who are assisting DACA recipients this open enrollment. And we'll close out with just a few key takeaways. So as Joyce very helpfully teed up for us, starting November 1st, DACA recipients will be considered lawfully present for purposes of enrolling in a qualified health plan through the marketplace. They can qualify for financial assistance for their marketplace coverage. The types of financial assistance available are advance payments of the premium tax credit, which are subsidies that reduce the premiums that a consumer has to pay for their marketplace coverage each month, and cost sharing reductions, which reduce consumers' out-of-pocket costs for things like co-pays and their deductible, as long as they are otherwise eligible. DACA recipients may also be eligible for a basic health program in the states that choose to operate it. These are Oregon and Minnesota. And I do just want to clarify that while we're very excited that DACA recipients are going to be eligible for marketplace or BHP coverage, there were not any changes in the final rule that apply to Medicaid or to CHIP. So Medicaid coverage for DACA recipients continues to be limited to treatment of an emergency medical condition, which includes labor and delivery. And DACA recipients are generally not eligible for CHIP unless they're eligible for what we typically refer to as the from conception to end of pregnancy group for individuals who are pregnant. Non-citizens who are not eligible for full Medicaid or CHIP will generally be eligible for marketplace coverage with financial assistance. This includes DACA recipients as of November 1st. And this also includes individuals who may not meet the typical income threshold for qualifying for financial assistance through the marketplace, which is 100% of the federal poverty level. So for DACA recipients who have income under that 100% of the federal poverty level, they can still qualify for APTC and for CSRs or for BHP coverage. And that's because they are ineligible for Medicaid or CHIP due to their immigration status. And finally, just want to note that individuals can be eligible for both marketplace coverage and for treatment of an emergency medical condition through Medicaid. So here at the federally facilitated marketplace, we are working hard to make sure that all of our systems are ready and going to be updated on November 1st so that we are correctly evaluating DACA recipients' eligibility for marketplace coverage. And we've been working closely with our state-based marketplace partners to implement similar changes in their system. In states served by the federal marketplace, we want to make clear that the best course of action for DACA recipients is going to be to apply directly through the marketplace. That's either online at healthcare.gov, through the marketplace call center, the numbers are listed there, through an approved, what we call enhanced direct enrollment entity. These are third parties through which you can enroll in marketplace coverage. And there's more information about those on healthcare.gov. And these are the options that DACA recipients can utilize this open enrollment period. Excuse me. Okay, I just want to briefly touch on a few additional changes that the final rule makes beyond changes for DACA recipients. So the rule does newly include certain smaller, discrete groups of non-citizens newly in the definition of lawfully present for purposes of marketplace and BHP coverage. This includes all non-citizens with work authorization. Many non-citizens with work authorization were previously covered, but we have expanded to a few small groups that were not included in our previous definition, so that now if someone has an employment authorization document, also called a work permit or an I-766, the marketplace will consider them lawfully present without needing to look at the underlying immigration status or category for that individual. There's a small group of family unity beneficiaries that were not previously included in the definition that are now included. Individuals who have a pending application for lawful permanent resident status or for a green card are no longer required to have an approved immigrant visa petition along with that application in order to be considered lawfully present for marketplace purposes. And individuals who are under age 14 who are applicants for asylum, withholding of removal, or relief under the Convention Against Torture are no longer required to have that application pending for 180 days before they can be considered lawfully present for purposes of marketplace coverage. And finally, we made a change to our definition to clarify that children who have an approved petition for special immigrant juvenile classification are considered lawfully present. This was a gap in our previous definition that we're glad we were able to clarify in this final rule. DACA recipients and the other non-citizens that we talked about on the previous slide can apply for coverage during the upcoming marketplace open enrollment period for marketplaces on the federal platform. That's November 1st through January 15th of 2025. DACA recipients and other non-citizens are eligible for an existing special enrollment period. That is for individuals who have become newly lawfully present. They qualify for this special enrollment period because of the rule. And this special enrollment period is available for the 60 days following November 1st. So that's from November 1st until December 31st, 2024. And we'll talk about the application process in a little bit more detail, but at a high level, DACA recipients who are applying will see guidance in the application telling them that they should attest that they have newly gained eligible immigration status and that they gained that status on November 1st, which is the effective date of the rule. Again, we have, as clear as possible messaging about this in the application, but going through that process is key to ensuring that individuals qualify for the special enrollment period for which they're eligible. Folks may be wondering why we're talking about special enrollment periods, given that we're heading into open enrollment, and during open enrollment, a consumer doesn't need a special enrollment period in order to enroll in coverage, and that is true. But the special enrollment period can help DACA recipients have their marketplace coverage start sooner than it otherwise would. So for DACA recipients who want their coverage to start December 1st, 2024, that's the kind of earliest effective date that's going to be available through the federal marketplace, they should be completing their application between November 1st and November 30th. So once open enrollment starts and prior to December 1st, and again, as we mentioned on the previous slide, making that attestation that they have newly gained eligible immigration status on November 1st. And then for DACA recipients who want their coverage to start on January 1st, 2025, if they complete an application for 2025 coverage during the month of December and similarly attest that they are gaining eligible immigration status, their coverage will start January 1st, 2025. And this offers DACA recipients more time to enroll. Typically during open enrollment, consumers need to apply by December 15th, for example, in order to have their coverage start January 1st. So the existence of the special enrollment period gives these individuals through the end of December to enroll, though of course we encourage consumers to enroll as soon as they are able. Okay, this is like a step-by-step going through the healthcare.gov application. Like, what are DACA recipients going to see? What should they keep in mind? And I'll try to go through this at kind of a high level. I know it's a lot of information, but kind of at the very beginning, consumers need to select whether they are applying for 2024 coverage or for 2025 coverage. So for those consumers who want their marketplace coverage to start on December 1st, they need to select that they're applying for 2024 coverage. As they move through the application, they'll be asked questions about themselves. They'll be asked to provide their social security number. DACA recipients do generally have social security numbers, and applicants for coverage are required to provide those on their applications. Moving into questions about U.S. citizen and immigration status, DACA recipients would first be asked whether they're a U.S. citizen or a national and should select no. They'd then be asked whether they have eligible immigration status. And again, they'll see a lot of guiding language on this page and some very detailed lists of who's considered to have eligible immigration status. And on this page, DACA recipients should select yes, that they have eligible immigration status for purposes of marketplace coverage. Next, they'll be asked to provide information about their most recent immigration documentation. It's really critical that consumers provide as much information as possible as they're moving through the application. This will help avoid them needing to submit further documentation later and can also help us avoid erroneously assessing them eligible for Medicaid if they might otherwise be eligible. We need that information to be able to tell that they're a DACA recipient so we can evaluate their eligibility accordingly. So that's the next piece of the application. And then again, highlighting the special enrollment period piece again, they'll be asked about recent life changes, including whether they have recently gained eligible immigration status. They'll see all kinds of nice on-screen guiding content, guiding DACA recipients to say that yes, they've gained eligible immigration status and that they gained it as of November 1st, 2024. As I mentioned earlier, the marketplace does verify immigration status for applicants through the Department of Homeland Security. Information that consumers provide on their marketplace application will only be used to determine their eligibility for health insurance coverage and will not be used for immigration enforcement purposes. As I mentioned earlier, it's really important for consumers to provide information about their immigration documentation so that we don't generate what we refer to as a data matching issue, meaning that they would need to, follow up with the marketplace and submit documents after the fact in order to resolve the issue. But if someone receives a data matching issue, they'll see information about it in the eligibility notice they get from the marketplace. They should respond to the notice by uploading the documents that are requested. It's going to be very similar documents to what we request in the application itself, so that we're able to verify the applicant's immigration status. Most DACA recipients will have an employment authorization document, and this is sufficient to resolve a data matching issue for our purposes, and we have some additional resources here. It's really critical that consumers resolve any data matching issues they receive in a timely manner, or they could be at risk of losing their eligibility for marketplace coverage. The length of time that consumers typically have to resolve these issues is either 90 or 95 days, depending on the type of information we're trying to verify. These are some best practices that we've been sharing with some of our partners throughout the rollout for this final rule, particularly for assisters, navigators, others who are going to be working directly with DACA recipients to enroll through the marketplace for the first time. These are some key points that we want to highlight. As I mentioned earlier, really emphasizing that any information that they provide on their marketplace application about immigration status will only be used to determine eligibility for marketplace coverage. In addition, marketplace coverage, including financial assistance, is not countable in a DHS public charge and admissibility determination. We also want to emphasize that the marketplace is only going to ask about U.S. citizenship or immigration status for members of the household who are applying for coverage. So if there's someone on the application who indicates, I don't need coverage for myself, we are not even going to ask those questions. We would never know whether they're a U.S. citizen, whether they're undocumented, anything in between. So those are only questions that we're going to ask about for consumers who they themselves are applying for coverage. As I mentioned, providing as much information as possible about the immigration documents that someone has is really crucial to ensuring that the marketplace is able to appropriately evaluate eligibility for individuals. We have some points here about avoiding unnecessary questions, kind of related back to the fact that individuals who are not applying for coverage have no reason they need to disclose anything about their immigration status. I'll also note that questions about race and ethnicity on the marketplace application are optional. And additionally, have some pointers here about consumers who may need help with identity verification, which is kind of the first step in the process of applying through the marketplace. These are resources that the consumer would see as they're moving through the online experience as well, but just wanted to re-emphasize here that the Marketplace Call Center is a great resource for helping consumers resolve any issues that they have with verifying their identity with the marketplace. All right, to recap, starting November 1st, 2024, DACA recipients and the other groups of non-citizens impacted by the final rule will be considered eligible to enroll in marketplace and BHP coverage and for financial assistance if they're otherwise eligible. There are not any changes to Medicaid or CHIP eligibility for this population, meaning that DACA recipients continue to be ineligible for full Medicaid or CHIP. DACA recipients and other non-citizens impacted by the rule should apply at healthcare.gov. or with our approved enhanced direct enrollment entities or through the Marketplace call center. We encourage DACA recipients to work with assisters, navigators, agents, brokers when applying through any of these channels. And finally, DACA recipients who apply for coverage between November 1st and November 30th can have their Marketplace coverage start as soon as December 1st, 2024. So I know that was quite a lot of information. I'm going to drop some resources in the chat that include all of this information and even more. And with that, I'm going to pass it to my colleague Stephanie, who is with the CMS Office of Communications. Thank you.
Great, thanks, Morgan. So the Office of Communications has taken all of this great work, and we have put it into a toolkit. I will put the link into the chat. It is posted there now. But the toolkit is available to help organizations and partners like yourself connect DACA recipients to health coverage. And so again, this is specifically for y'all to use. We have a little short intro for the toolkit, including some background. And we developed this after meeting with several organizations, trying to understand what resources would be most helpful to communicate to DACA recipients. So we've created and included in this toolkit a fact sheet, frequently asked questions, a drop-in article, social media messages, a postcard, and a fillable flyer. So right here, we have our frequently asked questions. Y'all can go through here if you have any questions. If you get any questions, hopefully they will be answered here for partners. And then we have a drop-in article. Each of these is, we have the toolkit package as one PDF, but we have individual links to each of these resources. So you're able to download the drop-in article independently. You can share this in a listserv or a newsletter, wanting to make sure you get the word out to any organizations who might be interacting with DACA recipients. This drop-in article has steps to enroll and then how to get help. I will say that this was designed to go to healthcare.gov for FFM states, but y'all can take information from here if you're in a state-based exchange and use it how you can. But we only made one toolkit for the FFM states for healthcare.gov. We also have healthcare options for DACA recipients, and so this includes how to get coverage through the marketplace, getting help paying for their plan, about the special enrollment period. So this kind of breaks it down a little bit more. We know it can be a little bit confusing, but if they want coverage for 2024, then they can apply between November 1st and November 30th. And then once they complete their 2024 application, they can enroll and update their application for 2025 to get coverage starting January 1st. So we kind of broke all of that out here on the different dates. And then we have information about Medicaid and CHIP, what Morgan talked about in terms of not being eligible. We have social media messages. When you go in and download this, you'll be able to download both the graphics and the post copy. Feel free to use our graphics. If you don't want to use the graphics and have your own, and you can just use our copy, you can do that as well. But we want to make sure that folks know that the plans can be as little as $10 a month or less with financial assistance, and that 4 or 5 customers can find that. And then we have basically the same messaging as going to healthcare.gov starting November 1st. I will note, if anyone goes to healthcare.gov today or tomorrow, it's not going to be updated yet, as Morgan said. So stressing that starting November 1st is when they can go in and start looking for plans. So here's our social media. And then we have a postcard available here with a QR code that takes you to healthcare.gov. Unfortunately, we just because of the timing of this, we weren't able to print these and stock them in our warehouses. So you will have to print these yourself if you want the postcard, but we do have the graphic here. And then we have a fillable flyer. So if you or any of your partners might be navigators or an organization who's going to offer direct help with enrolling DACA recipients, we've created this flyer for you to be able to send out digitally or print and hang up. And that includes how to call and contact someone or a website that they can visit. And then last, we have additional resources here, including all of the individual links to this. We will be translating this into Spanish, but that's right now is the only language that we are translating the toolkit into. we do have a number of AA and HPI languages on our regular open enrollment marketplace toolkit that have been translated. And all of those tools and toolkits, as well as this one, are located on our partner tools and toolkit page, which is live now. And I will go ahead and put that in the chat for y'all.
Thank you so much, Stephanie and Morgan. And also letting folks on a call know that the health forum will also send a follow-up email to this call with the resources that folks put in the chat. Next is Ben Vanzo, Senior Strategist on Health Advocacy at the National Immigration Law Center. He leads NILC's federal health advocacy and language justice work, where he works with Congress, executive branch agencies, national stakeholders, and community organizations to advocate for immigrants' access to healthcare and healthy lives. Ben?
Hi all. I showed my screen that I didn't realize where the mute button was. Thanks for having me, Joyce. It's great to co-host this webinar with you all. And it's great to see some familiar names that I haven't seen for several years now in the webinar. I really appreciate you all joining and your willingness to help get the word out about this exciting development. I'm going to touch a bit on, from an advocate's angle, some of the content and background that CMS shared, but I think maybe in a way that you all would find helpful as a complement. So I'm going to kind of go over where DACA folks fit in the overall scheme of immigrant eligibility that you all work on every day, a little bit of the timeline and overview of the policy, a reminder about who DACA recipients are, and some of the best practices for outreach and messaging that we've come up with. So we often use this kind of three concentric or interlocking circles to kind of talk about the overall framework, the legal framework for different immigrant eligibility rules. So all immigrants, it includes immigrants regardless of their immigration status, are eligible for emergency services and for federally qualified health centers. They also are eligible for public health programs, reproductive health programs, things like that. Lawfully present immigrants are eligible for Affordable Care Act marketplace subsidies, and in certain states, Medicaid and CHIP for people who are pregnant and for kids. And we have a map on NILC's website if you're interested in which states are which. And then qualified immigrants is the most restrictive category, and those are folks who can get Medicaid and CHIP, as well as other means-tested public benefit programs like SNAP and TANF and SSI. So DACA recipients, up until Friday, have been in the all immigrants category. They've basically been treated as undocumented for the purposes of healthcare program eligibility. And now what this final rule does is, for the purposes of the Affordable Care Act only, is moving those DACA recipients to the lawfully present category. Not for Medicaid, as the folks in CMS noted. The rule only addressed Affordable Care Act eligibility, although there are very few children who are DACA left, but there are, of course, folks who are pregnant who are not going to be able to get Medicaid, but they can still get ACA coverage, which is very robust, especially for very low-income people. So how we got here, right? The ACA was passed in 2010, and the law itself said that immigrants who are lawfully present, which is not an immigration category so much as a term of art used in public benefits, more or less meaning the government is aware in some way of your presence in the United States. Those folks are eligible according to the Affordable Care Act text. But when the Obama administration created DACA in 2012, it said, well, they are not eligible for the ACA. They are not considered lawfully present. And that was a proactive move that was put in regulation that now, and really deeply appreciate folks like Stephanie and Morgan and many of their colleagues who worked to make this rule final. HHS published the final regulation. I will note that earlier this summer, Republican attorneys general did file a lawsuit to try and block the policy, and that is something we are tracking, although we did not want DACA recipients to focus on it because that could deter enrollment. So this more or less restates what the folks at CMS said, but the rule ends the exclusion for DACA recipients, also addresses those other groups of immigrants like asylum seekers, people with employment authorization that are getting clarification or access to the ACA under this rule. Does not include Medicaid. And I'll say, the folks at CMS, like that is something they could finalize down the rule. CMS and the proposed rule included Medicaid, and for a variety of reasons did not include Medicaid in the final rule, but did not close the door down the road on addressing Medicaid. And the changes are effective in 2 days, November 1st. So I do want to address that litigation because we've been getting questions about it. So certain states have filed a lawsuit saying that this is an unlawful policy. Do not agree with that. And the government doesn't either. The government is ably defending the rule, and we have also filed to intervene on behalf of DACA recipients. Is NILC, that is something that is pending. The judge has had one hearing so far and has not made any actions or statements. And so we're taking an approach is if there's something that we think folks enrolling in ACA coverage need to know about this lawsuit, we will provide guidance and information then. We do have a landing page on our website about it, but we don't want to draw too much attention to it because of the potential chilling effect that it could cause. So, right, there's over 530,000 DACA recipients, and they range from 100 birth countries. And that's why it's really important that the Health Forum is doing this webinar, because there tends to be a perception that DACA recipients are all from South America. And while many are, that is not true. Their DACA recipients are from all over Asia and the Pacific Islands, as well as Africa and Europe and other countries. And so it's really important to recognize that there is no one stereotypical DACA recipient, and you should not make assumptions that someone is a DACA recipient or is not a DACA recipient because of their country of origin. DACA recipients are no longer really youth because of the rules about when someone had to come to the country, as well as some of the restrictions that have come through other litigation around DACA itself. There are only a few hundred DACA recipients left who are under the age of 20. But they are parents to more than 250,000 US citizen children. And so we think this policy is really important, not only for DACA recipients, but because we know they're US citizen children who are already eligible, but may not be enrolled in coverage, may get enrolled as a result of this policy. And we think that's really exciting. We did a survey, and we do an annual survey with United We Dream and Center for American Progress to DACA recipients, and we published a report earlier this year, and this is the third report we published based on that survey about DACA recipients and their access to healthcare. We found that 20% of responding DACA recipients are uninsured. Previous years, we found that to be as many as 1 in 3 DACA recipients are uninsured. So we think it is somewhere in between there, potentially even higher. But those who do have coverage have it through their employer. And so the folks we're talking about here are folks who do not have the type of job that would provide insurance, or at least affordable insurance. So maybe people working in the gig economy, maybe people working for small business or entrepreneurs or contractors, as well as students and people who just are not in the workforce. But 1 in 5 of our respondents said that immigration status negatively impacted their health. And 1 in 3 said that they skipped healthcare or medical care or tests because of their fear of cost. And so this is going to be really transformative for folks like that. We asked them, how do you want to get information? And a lot of them said they really want to know about how much it's going to cost. How much does health insurance cost? And those of you who do outreach and enrollment on day-to-day basis are not going to be surprised by this. Most people's primary concern about getting health insurance is, how much is it going to cost? Can I afford this? Is it actually going to be good health care? And how do I choose between a plan? There are many plans to choose from, and CMS is making some great steps in having standardized plans and making it easier to choose between plans, but it's still complicated. And about a third also really want to know what enrolling in coverage would have on their immigration status. We also found that it was really important that people really want to get information from the federal government. So that toolkit that the folks from CMS shared is really important, not just as a resource, but as a source of official information from an authoritative entity, and we're hoping USCIS will also post some information in the next coming days as well, because DACA recipients are going to look to the federal government. They're used to looking to the federal government for information about their DACA status, and they will want to verify that anything about getting health care coverage is accurate and true from the actual federal government. They do, however, want to look at informational videos. They do appreciate videos. They do appreciate social media. But ultimately, I think they want to get from that, the social media, from TikTok videos and stuff like that, back to the original government sources that can verify this is all true. We also conducted a couple of focus groups with Young Invincibles, and we found that DACA recipients were skeptical, that they didn't know that this was going to be real, that is this a scam? If they saw an ad, DACA recipients can now get health insurance, they would assume that someone's trying to scam me. That can't be right. And again, they want to look to federal government for information and other kind of official trusted sources. However, at the same time, a little contradictory, right? A lot of them use informal networks. Like there are many DACA recipient Facebook groups. There's a very active Reddit. There are informal social media networks, group chats, WhatsApp, all of you who, again, know this very well, that informal social media groups, WeChat, etc., are very heavily used. And we think it's really important to be present in those spaces to provide that official government information. We also found that in-language media is helpful. So DACA recipients are generally going to be English proficient by the nature of what it takes to get DACA. Many of them were raised speaking a non-English language and find that they do consume media in non-English languages, and that their family, who might be the ones to tell them about this opportunity, also consume information in non-English languages. We really do suggest working with ethnic media and other ethnic social media as well. And DACA recipients are generally unfamiliar with health insurance. And this is true of immigrants broadly, but if you've been uninsured and you're not familiar with the US healthcare system, concepts like premiums and deductibles and copay and coinsurance and formularies are overwhelming and confusing. Our partners at Young Invincibles have some really good resources, and HHS has Coverage to Care, which is also a set of really good resources about how to use your health coverage. And so we really recommend providing information on how to understand and how to use health insurance. So open enrollment starts November 1st. As the folks from CMS said, there's going to be a special enrollment period, meaning that if DACA recipients sign up before the end of November, they'll be able to get coverage starting December. They'll have to make sure they mark that they want 2024 coverage. And we'd really encourage those of you helping folks to enroll to think about the types of plans someone who's getting health coverage for 1 month in the plan year would want, very low or no deductible plan, for example. And DACA recipients, if they enroll by the end of December, can get coverage starting January 1st, and they have to use this special enrollment period for that. Otherwise, they wait until the second half of December. They'd have to wait until February to get their coverage. We really want to know if there's going to be glitches, if there's problems enrolling, if there are success stories, please let us know. That's the best way to make sure this policy is a success and people know what's happening, is to uplift the stories of those who are getting health insurance. And we will be at NILC tracking the lawsuit and providing any updates. And feel free to join. So we have a ACA for DACA campaign that we have launched. The Health Forum is part of that. We are providing a toolkit with resources. If you all are developing any resources, we will uplift it and put it in that toolkit. On our website, I'll post a few links in the chat after my presentation to some of the public resources we've developed at NILC. But invite you to join us in Health Forum and others so that you can stay in the loop, get all the full resources, sample social media, messaging, stuff like that, so that we can get the word out. And I think that should be it. Yep. So thank you, Joyce, and thank you all for listening.
Thank you so much, Ben. We have Sukyoung Oh, Executive Director of the Humke Center, formerly known as Nagasaki, Virginia, to provide a CPO and navigator perspective on the new eligibility. Sukyoung has spent 2 decades working with community members to design and lead issue-based campaigns to win systemic change, training dozens of organizers and community leaders, conducting data and policy analysis, and building partnerships. Sukyoung?
Hi, thank you so much for giving me the opportunity to speak here. I'll be providing some perspective as an organization that does immigrant rights organizing and advocacy work, as well as an organization in Virginia that does provide healthcare application assistance services as a navigator. Before I begin, I loved all of the background, and I think a lot of you got a lot of the like technical information, and that's all really important. I think it's also really important to stress that how this change in these rules came about was because of the continued organizing and advocacy of DACA recipients, of allies, of undocumented communities who are, while pushing for a path to citizenship, also saying, hey, I live here, I belong here, this is my home, I pay taxes, I should also have access, right, to these public services that will ensure that I have a healthy life, and that I can promote the public health of my communities. So, just if any of you have played any kind of role in any of these fights, I just want to take a moment to applaud you all. So thank you very much. Next slide. So who is Hamke Center? Really briefly, we're a community-based organization in Virginia. We organize Asian Americans to achieve racial, economic, and social justice. And as I said before, within the programs that we provide, there is a staff person. She is a certified navigator dedicated to healthcare services provision. We never would have entered this space except for the fact that we have in Virginia a track record of expanding healthcare access to immigrant populations at the state level. And so one of our partners, the Virginia Poverty Law Center, we had just won this thing around removing, it's very wonky, like the 40-quarter rule in Virginia to allow more legal permanent residents to be able to apply for Medicaid. And they knew that we provided other kinds of services, so they approached us about joining Enroll Virginia, which is a statewide network of navigators, and whose goal is to enroll Virginians into public healthcare programs, including Medicaid and the Affordable Care Act. So, and the representatives from CMS mentioned how like the toolkit that participants will be getting a copy of, it was tailored for states that participate in the federal-based exchange. Please note that some of you may live in states that do not participate in the federal-based exchange and instead have a state-based exchange. So you're going to want to go through your state-based exchange to apply for the ACA, if that is the case. For example, that is the case in Virginia. In 2023, we started using a state-based marketplace. And it looks like the Health Forum will be rolling out tomorrow a resource to help people figure out, hey, I live in blank state. Is it a federal exchange or a state-based exchange? So you guys should look out for that. Next slide, please. So you may have heard the term navigator a couple of times. I just want to share what that is. A navigator is an individual or entity who has gone through training and is certified to assist with insurance application and enrollment processes through the exchange. You don't necessarily need certification for Medicaid enrollment. And navigators also refer people to free or low-cost health resources. At least they do here in Virginia. And unlike some insurance agents, navigators present information on all plans, and the final selection is up to you, the community member. No, unlike some insurance agents, navigators have no financial incentive to pick a particular plan. Next slide. So gearing up for November 1st and open enrollment, what have wanted to share a couple things that we've been doing here at Hamke Center, not only to reach out to DACA recipients, but also to the overall Asian American communities, in particular in Northern Virginia, it's outreach, outreach, outreach. So here's an example of a print ad that ran in the Korea Times. We're going to be having an upcoming naturalization and health services clinic on November 9th in 2020. No, I got that right? November 9th. So I think it's a Saturday. So if you're in Northern Virginia, we will have staff ready at this clinic. Otherwise, we do work with folks on a one-on-one appointment basis. It was really interesting to learn all about the different modalities that CMS is going to use to do outreach, as well as the focus group findings that NILC shared. What we have found as a navigator is word of mouth is a huge way that people learn about the ACA and open enrollment. And so we're reaching out to all the DACA recipients that organize with us, first of all, hey, come in, make an appointment for November 1st, right? We're really trying to encourage those folks to be as ready as possible on November 1st to apply. And then to tell their tell their friends and tell their networks, at least in Virginia. We cannot provide navigator assistance, outside of your state, but every state will have some sort of statewide navigator system. So, you don't have to worry about like, oh my God, do I have to apply for this on your own? No, like states have navigator systems. We do emails to our entire listserv. We, leading up to the November 5th election, we've been doing nonpartisan canvassing, and so we've been passing out flyers about open enrollment. We talk about it at in-person tabling, at places of worship, ethnic media. One of the things like you're wondering like, well, a lot of DACA recipients speak English, but something that we found is that oftentimes it's the parents of the DACA recipients that they'll see the news and then they'll tell their kids. So that may not necessarily be the case. I'm not saying that that's always the case, but we have found that it's also important, consequently, to have in-language materials. And with ethnic media, we also try to do as many interviews as possible. And as I said before, we often rely on like who are the folks who are already organizing with us that have DACA to also spread the word to their networks. Next slide, please. I'll skip this slide. This is you all saw this before, that the marketplace expanded to include other groups of non-citizens, so we can skip that one. I do want to emphasize how Asian Americans and Pacific Islanders can benefit from the expanded rule. So I took a look at the Migration Policy Institute. They have in their DACA tools section, and I pulled out the Asian the API countries, and this was some of the data that was shared. So overall, like about 10% of current and active DACA recipients are AAPI, and here are some of the largest these are the countries that were listed on the MPI website. Well, we can move on to the next slide. I wanted to kind of a bummer. As an organizer, I don't like to end on a challenge, so I'll try to figure out something else to say at the end. But as our experience providing, so these challenges are not necessarily, about healthcare, about ACA application services to DACA recipients, because that hasn't started yet. But this is more around our experience working with Asian Americans, some of the challenges that we've seen. So language barriers is obviously a big one. We are in the Commonwealth of Virginia. We are one of the very few navigator sites whose primary language is not English. As the representatives from CMS shared, the Affordable Care Act, there's a lot of technical aspects to it, like premium tax credits and stuff like that. So that has also been a challenge for as navigators is you're trying to understand this stuff in English is hard enough, but then you're trying to talk about it in another language. And occasionally folks from different countries, who from different countries, they'll have a different sort of orientation about how healthcare systems work. And then they're here in the US and they're like, what? This is how people get healthcare in this country? It can be very different experience for them. You should be aware, right, to be able to apply for the ACA, you do have to file taxes. And with the taxes, what we have found is that there are some people who are lower income. They are eligible for the ACA, but they don't typically always file their taxes. But for the ACA, you have to submit taxes. And if you don't submit your taxes for 2 consecutive years, then you won't be eligible for applying or renewal. So that's just been another educational piece that we've had to, share with Asian Americans occasionally. We have run into at times that there is additional time and additional step needed to verify documents related to immigration status. So normally an appointment with the navigator will take about 1.5 to 2 hours. But if you have to verify immigration status, sometimes the exchange website, or maybe it's just Virginia's, it doesn't immediately verify and or accept the information when you submit the application. So then you have to make additional calls. So as Ben shared, if people are experiencing glitches, it's really important to know what they are, because if there is a pattern, then that's something that can be addressed at a more systemic level. Sometimes community members will receive termination notices in an untimely manner, or being human, ask for support very close to the appeal deadline date, and that has sometimes these trying to challenge termination can it's doable. It can be a challenge if the notice is received late or the person comes to ask for support very close to the deadline. And what we found is that Asian Americans don't also always know about these things called qualifying life events, which is, as everyone heard, there is going to be this special enrollment periods for DACA recipients. And generally the ACA, right, the open enrollment, there's only a certain window for that. However, there are certain qualifying life events, like if you move or you were employed somewhere and you had health coverage, and then something happened with your job and then you lose that health coverage. You have a baby, stuff like that. If there with specific qualified life events, you can usually apply 60 days or after an event happens, even if it's outside the open enrollment period. So to wrap, I just want to reiterate how any and all of these rule changes don't happen in a vacuum, right? People make it happen. People power make it happen. Working together to put the pressure on decision makers and policymakers to do the right thing is usually how these things happen. And so please go if you are newly eligible to apply for DACA, do it as close to November 1st as possible. You can do it on your own. You can also see if there's a navigator in your state that can support you to do this. And stay active, right? Stay engaged. Because we know that even this step is not is not enough. There's so much more that we know that DACA recipients, that undocumented folks should have access to, and they don't yet. Thank you.
Thank you so much, Soo-Kyung, and thank you to all of our panelists for your presentations. We have a little bit of time remaining. We're just going to do a quick speed round. If there is one takeaway our audience should do from this call, what would you say it would be? And Ben, I'll start with you.
I would say, let's figure out, right, I'm going to become a little bit of an advocate. DACA recipients getting healthcare is really important. It was the one thing that this administration could do with their own executive action. There are millions of immigrants who remain uninsured and ineligible for public benefits. Let's make this program a success and uplift the wins of the stories who are getting health insurance for the first time, so that we can make the arguments as advocates together that the same healthcare access that has been extended to DACA recipients, and same with folks like COFA citizens getting Medicaid for the first time a few years ago. Let's show how great that has been for them and for their communities, so we can show that policymakers should do the same for all immigrants, regardless of their status.
Thanks, Ben. Soo-Kyung, I know you gave a few takeaways, but do you have anything else you'd like to add on?
Hey, if you live in Virginia and you want support applying for the ACA, we're a navigator. So you can contact Hamke Center, set up an appointment and do that, and organize with us here in Virginia.
Great. Stephanie?
Yeah, I would encourage folks just to go in and shop, to go in on November 1st and look. By just going into healthcare.gov, then they're going to be able to understand if they can afford a plan and find a plan for them, but they won't know unless they go in there. And to find a navigator, we have the Find Local Help feature that they don't have to do it on their own. So those are the two big things we want to push.
And Morgan.
Yeah, just to reiterate that, as of November 1st, we are open. And just to add that we really value the partnership with all of you here. And if you are seeing something that is not going as well as you might have hoped, please do reach out to us. Ben and Joyce and others know where to find us. And we really want to be making sure that we're doing everything we can to make this a success.
Thank you all. Really, really appreciate your expertise in sharing your time with us today. I want to follow up to folks on a call that we will send out these resources after as well, and that the Health Forum is launching our ACA Marketplace open enrollment site, which will have all of this information, including a map where it shows if you do have a state-based exchange, you can click through the map and go directly there. We have some additional translated resources, and also our Medicare open enrollment site is live now. But really, thank you all so much, and hope folks have a great day. Thanks.